So in this part we will be dealing with the internal surface of the cranial base, and it have got the three large depressions that lie at different levels: the anterior, the middle, and the posterior cranial fossa, which form the ball-shaped floor of the cranial cavity. The anterior cranial fossa is at the highest level, and the posterior cranial fossa is at the lowest level. So first we'll be talking of the anterior cranial fossa. The inferior and the anterior parts of the frontal lobes of the brain occupy the anterior cranial fossa. This is the shallowest of all these three. The fossa is formed by the frontal bone anteriorly, ethmoid bone in the middle, and the body and the lesser wings of the sphenoid posteriorly. The greater part of the fossa is formed by the orbital parts of the frontal bone, which support the frontal lobes of the brain from the roof of these orbits. So now these surface shows the sinus impressions of the orbital gyri of the frontal lobes. And this is the frontal crest, and this is a median bony extension of the frontal bone, and at its base here it's the foramen cecum of the frontal lobe, and basically this gives passage to vessels during the fetal development, but it is insignificant postnatally. And here is the CRISTA galli, is a thick median ridge of bone posterior to the foramen cecum, which projects superiorly from the ethmoid. On each side of the ridge is a sieve-like cribriform plate of ethmoid. Its numerous tiny foramina transmit the olfactory nerve, that is the cranial nerve number 1, from the olfactory areas of the nasal cavity to the olfactory bulb of the brain, which lies on this plate. Next we have is the medial cranial fossa. It's a butterfly shaped and has a central part composed of the sella turcica on the body of the sphenoid and the large depressed lateral parts on each of these sides. So the middle cranial fossa is posterior inferior to the anterior cranial fossa, separated from it by sharp sphenoid crest laterally, and this is the sphenoid limbus centrally. The sphenoid crests are formed mostly by sharp borders of the lesser wings of the sphenoid bone, which overhang the lateral part of the fossa anteriorly. Now the sella turcica is here. It is a saddle-like bony formation on the upper surface of the body of the sphenoid, which is surrounded by the anterior and the posterior clinoid processes. So this clinoid means bedpost, and the four processes, two anterior and the two posterior, surround the hypophyseal fossa, that is the bed of the pituitary gland. Now the sella turcica is composed basically of the three part. One is the tuberculum sellae, other is the hypophyseal fossa, and the third is the dorsum sellae. Now on each side of the body of the sphenoid, a crescent of four foramina perforate the root of the cerebral surface of the greater wings of the sphenoid. So first one is here is the superior orbital fissure. This is located between the greater and the lesser wings. It opens anteriorly into the orbit. The other is the foramen rotundum. This is located posteriorly to the medial end of the superior orbital fissure, and it runs a horizontal course to an opening on the anterior aspect of the root of the greater wing of the sphenoid into a bony formation between the sphenoid and the maxilla and the palatine bones, that is the pterygopalatine fossa. The other here is the foramen ovale. It's a large foramen posterolateral to the foramen rotundum. It opens inferiorly into the infratemporal fossa. The other is the foramen spinosum. This is located posterolateral to the foramen ovale and opens into the infratemporal fossa in relationship to the spine of the sphenoid. Now we have is the foramen lacerum. It's not a part of this crescent of foramina. This ragged foramen lies posterolateral to the hypophyseal fossa and is an artifact of the dried cranium. In life, it is closed by the cribriform plate. Extending posteriorly and laterally from the foramen lacerum is a narrow groove for the greater petrosal nerve on the anterior superior surface of the petrous part of the temporal bone. Now coming to the posterior cranial fossa is the largest, the deepest of all these three cranial fossas, lodges the cerebellum, pons and medulla oblongata. The posterior cranial fossa is formed mostly by the occipital bone, but the dorsum sellae of this sphenoid marks its anterior boundaries and centrally, and the petrous and mastoid parts of the temporal bones contributes its anterolateral walls. Now from here the dorsum sellae there is a marked incline, and this is the clevis in the center part of the anterior part of the fossa leading to the foramen magnum. Posterior to this large opening, the posterior cranial fossa is partly divided by the internal occipital crest into bilateral large concave impression and the cerebellar fossa. The internal occipital crest ends in the internal occipital protuberance formed in relation to the confluence of the sinuses, a merging of the dural venous sinuses. Now these broad grooves, these show the horizontal course of the transverse sinus and the S-shaped sigmoid sinus. At the base of the petrous ridge of the temporal bone is the jugular foramen, which transmits several cranial nerves in addition to the sigmoid sinus that exits the cranium as the intrajugular vein. And on the anterior superior to the jugular foramen is the internal acoustic meatus for the facial nerve and the vestibulocochlear nerve and labyrinthine artery. Now here you can see is the hypoglossal canal for the hypoglossal nerve. This is superior to the anterolateral margin of the foramen magnum. So this was all about the interior surface of the cranial base. Thanks for watching.